Okay.
So welcome everyone. I am delighted on behalf of the Maryland Colorectal Cancer Task Force to welcome you to a webinar for medical assistants, empowering you to discuss cancer screening options with your patients. And I am Dr. Arti Varanasi. I'll be moderating the session today. I'm with Advancing Synergy and really honored to be a part of this special webinar today in honor of medical assistants. So before we begin, just a few quick reminders. This session will be recorded and then posted on the Maryland Colorectal Cancer Task Force website in the coming weeks. The lines will be muted during and then opened up during the Q&A portion. And if you have any questions, please post them in the chat as we go through the presentations so that you don't forget your questions. And we will be having an open Q&A session with all our speakers at the end. And at this time, I would just like to share a little bit about the Maryland Colorectal Task Force. The Cancer Roundtable is a state-based volunteer effort designed to reduce colorectal cancer incidence and mortality burden within the state by achieving at least 80% colorectal cancer screening. And you all are an important part of that. Our overarching priority is to convene audiences of leaders in Maryland to set goals, objectives, and implement strategies to increase colorectal cancer screening rates. And you can see on this slide some of the members of our task force. We welcome new members, so if you're interested in joining, please reach out to us in the chat and we can talk with you more about this wonderful opportunity to support colorectal cancer screening in our state. Today, we are delighted to have with us three esteemed presenters who are knowledgeable in this area of empowering you and your patients. We have Judy Lichty-Hess, who is a senior improvement consultant with Health Quality Innovators and over 30 years of experience in healthcare. Joining her is Mary Joseph, who's a project manager at the Primary Care Coalition of Montgomery County and has deep experience in this space as well. And last but not least, we have Doris Lizama joining us from Catholic Charities, and she's a preventive and chronic care program coordinator. All of these ladies have amazing experience and a depth of experience, so we encourage you to ask them questions. And without further ado, it is my pleasure to turn this over to Mary Joseph to continue the conversation for today. And you can read each of the bios of these wonderful ladies in the chat. So Mary, over to you. Did we lose Mary?
Let me see if we can unmute her.
Yeah, that's what I was trying to do. Oh, there we go. Mary, can you say something? Let's see if we can hear you. Looks like you're unmuted. Mary? Uh-oh.
While we find Mary, as you can see, we have a deep appreciation for our medical assistants, and we want to thank you, our medical assistants, for all that you do. Your compassion, your dedication, your resiliency with no bounds. Our gratitude for your contributions this year and every year cannot be expressed enough. So I hope that this call shows our true gratitude, as well as your organization's appreciation this week and every day of the year.
Thank you, Kathleen. And just to echo that, we truly appreciate all of you. and thank you deeply. And so the objectives for our presentations today are to, one, identify 3 navigation barriers, describe ways to improve spoken communication, and describe one method, at least one method, to assess patients' understanding of patient education and instructions. And so I'm going to turn it over to Judy Lichty-Hess, who's going to be co-presenting with Mary Joseph.
Sure. Mary, whenever you get on, you can take over your slides. I'll get you started though on your side of it. I'm actually the tail end, but I'll try to do her justice. So good afternoon, everybody, and sorry for technology being what technology is. We appreciate you hanging on with us. So we wanted to talk specifically about health literacy and make sure that you understand as well, of course, I know we have medical assistants, but all others that are on the line too, to understand how important actually people having an understanding, the patients having an understanding what you're saying when it comes to the what's going on. And so you can see here that we've provided you a definition on what health literacy is. And then when organizations or people create and give others health information that is too difficult for them to understand, we create a health literacy problem. When we expect them to figure out what health services are that are unfamiliar to them, confusing or even conflicting steps, we create health literacy problems. And that really comes directly from the CDC. So we can understand, it's not about somebody not being smart enough to understand. It really has to do, and you'll hear me talk a little bit more near the end of the presentations about the medical jargon and so forth that we use. Artie, if you could move on. And so health literacy is not just reading. It's not just about a person being able to read something, to understand it. It includes things like written communication, spoken communication, numbers and math, using the health information, and navigating the healthcare system. That's what health literacy really is. And so for people to be able to, you could have a very well-degreed person that may be very, even have a PhD or something, but they don't understand, they're not going to understand colorectal cancer. That's not something that they've studied or figured out. And so making sure you don't talk down to people, but making sure that they understand what you're saying when you're trying to communicate on whatever the topic may be. Next slide, please. So here's some interesting statistics we wanted to share with you. Health literacy, as far as 88% of US adults have health literacy issues. 36% of US adults have a limited amount of health literacy, and 65 and patients that are 65 years and older, they're more likely to only have basic health literacy skills. That's important, particularly, a lot of the opportunities, you as even medical assistants, many times you're seeing those older patients. And so this is reflective in older patients, in minority populations, those who have lower social economic status, and are medically underserved are also, God bless you, are also impacted by this too. But we'll talk even a little bit more beyond those statistics about other populations too. So something about, did you know that 80% of patients will forget what their provider says? I bet you've experienced that. Did you know that 50% of what patients remember is recalled incorrectly? 42% of patients could not understand directions for taking medications on an empty stomach, and what time of day they should be taking the medications, and how to properly use them in all sorts of ways. 43% of patients did not understand the rights and responsibilities section of a Medicaid application. I bet you they didn't maybe even read through the whole application, because many of these consents and applications are so long. And so it does take time to go through that and make sure that they understand. And 60% of patients did not understand a standard consent form, as we say here. So it really is important to slow down a little bit. Sometimes slowing down a little bit can help us get through to them, and then in the long run, have better patient outcomes. We can go to the next slide, please. So what are some of the barriers? And before I do this, do we have Mary Jane on yet? I don't want to be running over her slides if she's on.
She is trying to dial in now.
Okay, should I give it a second before we hit this one?
If you could keep proceeding in the
Okay.
interest of time. Thank you.
Okay, I will do that. So, when we talk about, so what are some of these barriers, when it comes to the patient as far as navigation and understanding, with health literacy? Sometimes office locations and directions can be very confusing to folks. Automatic phone systems. Oh my gosh, have you ever been in voicemail jail? Something that I even get frustrated and very struggle with. And so understanding, back and forth, years ago when these automatic systems came on, how patients really didn't like it. I don't want to talk to an automated person. I want to talk to a person. So processes change. How is that impacting and being a barrier? Health history paperwork. Well, have you ever asked a patient to fill the same information out, like put their name and their address down on 3 different forms at the same time? They're frustrated, and they may or may not tell you about it, but why do I have to keep repeating and to keep telling you that? Insurance assistance or advanced care planning, paperwork processes, those certainly can be a big barrier for our patients. And then transportation. Getting to where they need to get, that can be a big barrier, whether it's family members or they have to take buses or all those things that go into making transportation an issue, or if whoever brought them leaves them. Can you imagine? And then they have to find a way home. I experienced that or viewed that for a patient not long ago when I was working with the practice, and the patient was there and we're like, well, my transportation left. I don't know how I'm going to get home. So all of these things can be barriers as it relates to them understanding and how all this will go, even with health literacy, because the additional stress. Mary, are you there?
I think, Mary, have you dialed in? We saw a new number. Not sure if it was you.
Okay, I'm just going to keep going, guys.
Yep, keep going.
Keep going. Again, interrupt anytime, Mary, that you are on. And let's go ahead. Thank you for going to the next slide here. So here are some navigation tips and resources. So walk through your facility and processes with health literacy lens, making sure that, as a team, either, and you can plan it together as a team, that you can take a walk through and see, like, okay, does this sign make sense? Is it in a language that your patients understand, if you have those patients that need it, or if the language is too above, a certain grade level, really take a look at making sure that your signs and even your forms and things like that have that lens as far as process and how it can be helpful to them. Encourage staff also to identify potential barriers, patient barriers, and provide education. So it's not just about what you as a medical assistant, but as a team, in working in these practices, remember that you're thinking about team-based care and how as a team you can work together to look at these things and really make improvements, and trying hard, to approach it as making it better for the patient and not taking defense when it comes to making these improvements. We really want people to understand and we want them to have good outcomes. And so how can we help them do that? Next is provide as much patient information for other providers. For instance, getting some ED summaries. We know now, particularly here in the state of Maryland, if we have information that's coming in from CRISP and how you can use those ENS reports and use that information in your practice, so that way you have the most information and you're not asking the patient, because they'll go, they're not feeling well already sometimes when they're coming in, right? And so asking them, well, give me this, give me that, give me the other, they're overwhelmed, and if they have more than one thing that they're working on, which many times they are, they certainly overwhelmed. So keep that in mind as you're working with them, and listening to them. And I'm going to cover a little more of that in a few minutes. And then other resources, making sure that we're providing other resources. And Mary Jane has a resource here from ARC on quality improvement. ARC is a great resource tip that you can, or link that you can use for all sorts of things, you guys, if you're working, and here's the other thing, I'm going to throw a little bit of my quality part of what I do with the practices that I work with right now. If there's something that you want to change, do it in a small increments. Mary Jane always worked with me on, small bites at a time. And so, looking at these small bites and making sure, as it relates to something, test it out, try it out and see if it will work with your practice, if it's getting you the outcome. And if it isn't, then go ahead and move on to other you try again. There's nothing wrong. A PDS, it's called a Plan, Do, Study, Act. A PDSA can be a matter of just, doing it 1 or 2 days. It could be a week, but you're not talking about doing these huge changeover plans. You're talking about making small changes that can really make a difference. Okay. Sorry. Next slide. I'm on my soapbox. Okay, so this particular wheel here that we have on navigating a patient. So, at first, and some of these things are very useful, when you can use text messaging or even emails with patients if they're on your portals to give them reminders about their appointments coming up.
Mary.
And, oh, did somebody join us?
Mary, is that you?
Okay, I'll keep going.
Going, Judy.
Okay. So the appointments reminders are important for the patients in navigating them. Follow-up phone calls also are very helpful. Confirm understanding and teach back method, which we're going to review here in a minute. Treatment simplification, again, and these are going to, and I'm going to reiterate this a number of times, that these are patients that many times are very well educated, and you may be surprised, but they're not medical professionals, or it even could be a medical professional, but doesn't even work in that particular area. So remember to not make assumptions that people know or understand things. Shared decision-making, that's huge. That's a big part of them, knowing that they understand and where they want to go and what the patient wants to do. Medication review. This is big, very, very big, because patients can be on multiple medications. There's even things coming up now about, okay, so a patient that has high blood pressure, they may be taking 2 medications. Well, maybe they can make the medications now into one, and so they don't have to take 2 pills, and all this remembering. So there's all this kind of communication that's happening, but looking for a way to simplify it. And also remember to be kind and supportive as a staff member to the patients, to each other, and these people can be very nervous. These patients can be very nervous and very worried and concerned. And so your kindness will go a long way with those patients. Okay, next slide, please. Okay, hold on a second. My slides. All right, so this is the start of my presentation here. So I think one of the greatest problems with communication is the illusion that it's occurred. Just because you say something doesn't mean that people understand what you're saying. That happens even in business and in everywhere. You're working with your colleagues, but try to remember, just because you said it doesn't mean they understand it. Next slide, please. And so we're now going to review some of the ways that makes it hard for patients to understand, and some of the ways that we can make it easier for them. Next slide, please. So we talked about barriers earlier, and so now we're going to talk about verbal communication barriers. There are things we have clinician monologue or medical speak, or acronyms. How we can use acronyms so much, particularly as it relates to the FIT test. Talking speed, we can be talking too fast. So remember, slow it down a little bit. Too many topics at once. If sometimes you just got, and patients may not understand to say, slow down. Can you try that again? Can you repeat that? because they're nervous about that. There's medical jargon, and information is often forgotten quickly. Can you imagine all the information that you're sometimes throwing at a patient and them trying to remember? Next slide, please. So the assumptions that can lead to miscommunication. So there's two areas that can lead to miscommunication. One is health literacy, and the other is cultural competency. So as you can see, health literacy, everything from being able to read themselves or understanding math and numbers or medical terminology, and medical concepts. We have a tendency to throw those together. And even with my husband, sometimes he'll look at me and go, "What?" I'm like, "I'm sorry. Let me take it out of my mind and put it into somebody else's mind." Bodily functions. But then also remember, another thing that's important with all of this is the cultural competency side. It's languages and health benefits and religious beliefs. Those are really important. Health practices and diets and supplements. People are doing different things, whether they're trying to lose weight or trying to gain weight or whatever it is. So keep that in mind. Next slide, please. Okay, so now we're going to talk a little bit about health literacy as universal precautions. Okay, so remember, you cannot determine what someone's health literacy by looking at them. Okay, health literacy can be, you need to identify and find it out in many different ways. We all approach understanding differently. And it's really important to slow down our communication. And that's a really big one, you guys, I know in this day and age, because, providers typically have 10 minutes with a patient, and having to get all of that out. And the provider needs, many times you as an MA to help support them. So that's important. You can't tell by looking, you can't tell by their skills and what their skills are. Everyone benefits from clear communication. So if we can keep that in mind. Next slide, please. Improving spoken communication. So, what are some of the things that are going to be keeping a patient at ease? And a warm greeting. "Good afternoon, Mr. Smith. It's so glad to see you," and have eye contact and truly listen to them. Make them think that they're not another number. Use plain non-medical language. Slow down. Limit how much you're going to give to them at once. Repeat key points. Frequency, I say this often, when it comes to even marketing and other things. Frequency, frequency, frequency. Saying it multiple times helps them go, "Okay, I get it." Because even on the radio, you hear commercials. They say that on average, it takes 17 times before you actually hear that commercial on the radio. I'm not saying it takes that many times for you with the patient, but remember, frequency is not a bad thing. Show how it's done. Use graphics. Invite them to participate in what's going on. Okay, next slide, please. So I want to cover something called the OARS model with you. The OARS model is a set of verbal and nonverbal communication skills that helps clinicians and educators in primary care practices and builds a rapport with patients to assess their needs. And you can see that there is a link here on the slide. First, let's talk about what open questions are. As a professional, this is one of the most important skills you can master. Using what, when, where, who, and how, and tell me as part of your questions. Open-ending, giving them the ability to give you more information and not just have short yes or no answers. The next is affirming. You want to build a rapport and show empathy with your patient. It takes a little more time, but it does require you to listen. And as an example, you may use something like, "It sounds like you're saying this." So that way the patient can say, "No, yes, no, I mean this," or "Yes, that's exactly what I'm saying." Okay. The next is reflective. Listening. This is the most important, challenging skill. Important to gain a deeper understanding. You say to the patient that you're concerned about their results, and you may even notice that they're sad today, or you notice tears in their eyes as you're explaining some of these things. So be reflective, and it goes a long way. And then finally, summarizing. It helps to move the conversation from beginning through the middle to the closing, and you can use things like collective summary and as an example. So let's go over what we've talked about today. Okay, and linking it a minute ago, you said you wanted to talk about, or it could be something else that maybe now we can talk about how you might try this test or how might you try this food, those kinds of things. And then lastly, you can stay on that slide. Sorry, Artie. So you can make a transitional summary could be, so let's make an appointment before you leave today so we can talk, so we can see you again soon as necessary. So those are some of the things around ORS. There, the link is there. It's great. It gives you some great tips. Highly recommend that you take a look at it. Okay. So now we can go to the next slide. Sorry about that. How do you know when patients understand? So this is when you may think they understand when they're nodding their head, right? Or when they ask questions, or when they have good health outcomes. But it's important to ask them and make sure that they are understanding what you're doing. And that's where I'm going to head down to the next slide. And we're going to talk a little bit about teach back. Okay, so teach back is a widely used technique to check for understanding. For instance, research has shown that teach back has been associated with a better control of, say, blood sugar by people with diabetes. You can use a teach back method to help by asking the patients to explain in their own words what you told them. It's a chance to check the patient's understanding and reteach certain information if you need. And some of you probably use teach back, I'm hoping, in your practice and what you do. So for instance, I'm going to give you an example. So your provider wants you to do a screening for colorectal cancer. I'm giving you the FIT test. It stands for fecal immunochemical test. And then what you can do is you can ask them, have you ever taken the test before? And then you can talk about this as a take-home test. And there are going to be some instructions, but you can review those instructions. Okay. And then you have them talk through, as you go through those instructions, you have them, so, you can pick some of these things out. So for instance, what is the steps that you're going to do after you've reviewed them with them, and and making sure that they understand. And if they didn't understand it, you can review it again. If they've had it again, I still would take the opportunity to review those steps. Okay. All right. So next slide, please. So here's some teach back openers as you're talking to the patient. I want to make sure I've explained your FIT test or this test to you clearly. Can you please tell me in your own words, and then give an example? When we went over a lot of information today, what are the important things that you're going to tell your family and discuss this with your family? And another one is, I've noticed that many people have trouble remembering how to take their medicine. Can you show me how you're going to take your medicine? So it's not telling them that, that they can't think or that they can't, belittle them at all, but helping them have information back and helping them understand. And don't just say, do you understand? Because guess what's going to happen? They're just going to shake their head. And many times it's up and down, it's not side to side. And so, and then things don't get done the way you want them to get done, and they don't complete their tests. Okay. So Mary and I were going to do a little play acting here if she's on. Are you on, Miss Mary? Okay. So we were gonna do this is the good person and this is the bad person, or this is the good way and this is the bad way to do it. So bottom line is the bad way is, here's a FIT test. We'd like you to take this home and and send it back to us. And do you have any questions? And the other way would be, here's the instructions, and I've sort of alluded to this earlier, here are the instructions, and review the different steps, and ask them to then repeat those steps to you. So I'm going to, do this, I'm going to do this, I'm going to do this. And that way you'll know that they were listening and that they understand. And everything about how to send it back in to, or whatever it is that you're working with them on, it's really important, because that way you know that you'll have better outcomes for the patient. So on the next few slides, a couple slides here, we have some resources that we wanted to share with you. And I know that you'll have the opportunity to get these slides themselves. And we so want to make sure that you can utilize these resources as you work with your patients. So Mary, are you on at all? And do you want to add anything to what I've said? Okay.
Judy, I don't mean to put you or our attendees on the spot, but is there the possibility anyone would like to volunteer to do a work?
Yeah, anybody want to volunteer? Anybody want to be the good way to do it, and I can be the bad way to do it?
Think about it. If you have any courage,
Yeah,
add
just
name in
raise
the
your
chat.
hand. It's good practice. You're amongst a friendly group.
Absolutely. I mean, I could call out a name. No, I'm kidding. I wouldn't do that.
Well, if you get some courage, put your name in there, raise your hand, and we'll be happy to role play.
I know a few of you. I know a few of you. I could call on a few of you, and hopefully you won't be mad at me, but
It's a safe environment.
it's a safe environment. Well, I see Mary Jane's name there.
I know, but I don't know why she's not able to connect.
Her computer must be misbehaving.
We've all been there.
That's for sure.
I can try.
Awesome.
Who's volunteering?
Doris.
Yeah.
Oh, Doris, perfect.
Okay, you can do. You're going to be after. That is perfect. You're going to be the good.
I can do the bad one.
You can do the bad one. Uh-oh. Okay.
So this is for how to teach when you're given the fit test.
So we can even go back to, let's go back a couple slides, Artie. Let's
This
go
one,
back
right?
to the one, the teach back method. So let's kind of at least be on that while we're talking, okay?
Okay,
So people
here
can
we
see
are.
that. All right, so go ahead, Doris. You do the quick one.
The quick one, yes. So it's not. I'm not gonna follow it will be like just like, Mrs. Pettis. The doctor wants you to do this test. Here is the envelope. You need to bring it whenever you have the next visit, or you can bring it in next week. That's like when you don't give any explanations of how, how they're gonna do it. But
Right.
I don't know. I was a little nervous, but we can try again. But sometimes that's how it happens. It's like they just handed it over, but I can try to. We can try it again.
Okay, all right. So let me go ahead and at least do a little bit, okay?
Yes.
All right, so I can say so Mrs. Pettis, your provider really wants you to take this colorectal cancer screening. The test that you're going to be using, that he's going to be using for you, is something you can do at home. It's called a FIT test, and the FIT means the fecal immunochemical test. And have you ever taken one of these before?
I
Okay.
haven't.
You haven't. Okay. Well, either way, let me explain to you what's going to happen. So, there's instructions. Let's open up the package. There's instructions here in the package that I wanted to cover with you. First, what they'd like you to do is flush the toilet. Okay. And before having the bowel movement, and then put the used toilet paper in the waste bag provided. Do not put it into the toilet bowl. Use the brush from the kit to brush the surface of the stool, and then dip the brush into the toilet water. Touch the brush, and at this point, hopefully you'll have a visual as I'm moving my hand back and forth and you guys can't see it. Use the brush from the kit to brush the surface of the stool, and then dip the brush into the toilet water. Okay. Touch the brush on the space indicated in the test card. Add the brush to the waste bag and throw it away. Send the sample to the lab, and here's the address on here where to send it. Okay. You'll need to put postage on it, or they may not. I'm not sure how practice would do that. And your doctor may ask you to test more than one stool sample before sending it. Okay, so tell me about, give me what you'll do when you first open your kit. Can you tell me what you'll do?
Yes, first I'm gonna open these instructions that have pictures that you just gave me.
Okay, good.
And then I'm gonna add my name to the sample that I'll be collecting.
Excellent.
Yes. And then I'm gonna flush the toilet before the stool, then open the bottle and brush it in different areas, and then wash it back in the toilet. I forgot that little part.
That's okay. Well, and that's why we're reviewing it, just to make sure that when you've seen it now with me, and then when you get home and you look at the instructions, you'll be able to do it again. It's okay.
Thank you. I
Mhm.
appreciate your patience.
Oh, sure. We want this, we want to get the information and we want you to feel comfortable in how you're doing it. So absolutely.
Thank you. So after that, I will close it, I put it back in the envelope, add a stamp, and mail it to the address that you gave me.
Excellent. Well, good. Well, I'm looking forward to, so maybe you can try to get that done and, within this next week as soon as possible. I'm looking forward to getting that information so then we can have you the results as soon as possible. Okay?
Thank you.
You're welcome. All right. So that's pretty much what, and thank you for being my compadre. I appreciate you.
You're welcome.
And so, are there any questions, or how did you want to handle that, Kathleen? We can look at questions later. Here's a toolkit.
Yeah, we're gonna look at questions later, but
Okay.
if you want to tell them, Judy, about this toolkit.
Yes. So this is a toolkit. It's from ARC again, who I mentioned earlier. This is a toolkit on how to do health literacy topics, whether it's spoken, written, self-management, and supportive systems. And there is a link, and that link was provided, I think, in the chat too, I saw earlier. Really strongly recommend that you take a look at it. Health literacy is not a difficult topic, you guys, but it's an important topic. And we just need to learn to slow down and make it stronger for you and the patient. Because remember, if you do it right the first time, you don't have to do it again. And so anyway, so that's pretty much the end of my presentation. A huge thank you to Mary, because Mary really helped put all this together on the front end. So I'm so sorry for technology problems, Mary, for you.
Yes, and thank you so much, Judy and Mary. This was a wealth of information, and it will be a resource for others since we've recorded the session. And the wealth of resources that were shared in the chat will also be shared via email post-presentation. So now it's my delight to actually turn it over to Doris Lizama, who you just met, who was part of our little role play. So Doris, really appreciate you volunteering, and even more grateful that you could join us today to talk about how MAs can get involved in cancer screening. So with that, I'm going to go ahead and turn it over to you.
Well, thank you very much, and happy to be here. Hello, everyone. So how we want, first, I want to start by celebrating you MAs and everything that you guys do. As we know, medical assistants are crucial in the healthcare field, especially now more than ever. And if you can please, the next slide, that's there, yes. And the next one. Yeah, so things that we value about our medical assistants is how you take each day as it comes, as Judith was mentioned. Sometimes we need to slow down a little bit, and how you guys keep track of all the performance during trainings, and as well as when you start in a new position, with everything that is happening in the healthcare. We are constantly moving our staff in the clinics, and I'm not sure if that's happening in the clinics where you guys are. the way you guys multitask, how you are open to criticism, the way you find a routine that works for you, how well you pay attention, and how well you get to know the physicians that you are working with. And that's very important when we are trying to include the screenings with the medical assistant support, because we have a lot of medical assistants that they know their physicians so well, the one that they're working with, that, you know, they will go ahead and remind the patients of, you know, what tests they are still missing, especially when it comes to screenings. Knowing the importance of being a team player is very important for these, the goals that we have to improve the screening rates. We all know that MAs have a passion and compassion, and all they want to do is to help others do important work and feel appreciated. And that's why I would like to ask you to give yourself a round of applause and a big hug today that we celebrating this day that, you know, is your day, as well as the breast cancer awareness. Thank you. Next slide. So questions to share. It is very important as a coordinator for preventive and chronic care programs. I have seen sometimes how when we get grants or ideas, we usually share it within our team, but then we don't realize that when we include our admin team, our MAs, we have to know if you know, they understand what the goal of the grant or the project that we are going to be working on. What is that goal? What is that initiative? And what is going to be the benefit of it? Like the need that we have in the clinic that we are working with. So that's why we have these questions to share. Does your clinic have a procedure or how to introduce you to new grants or initiatives that have to do with increasing the cancer screening rates? What do you think will be the most beneficial way to teach about cancer screening for the patients and the clinics without interfering with your daily tasks? Do you know all the cancer screening programs at your clinic, and who can benefit from them? Can you share with us how you educate patients about cancer screening? Because with Mary, for the past 8 or 10 years, we have been doing a lot of PDSAs, and we learn within all our community clinics and the network, the primary care coalition works, that we work differently, but we learn from each other. During these monthly meetings, we learn, we do PDSA, and that's very important, bringing that back, not only to the physicians, but all the staff, the MAs especially, because they are the ones that are closer to the physicians and the patients. Next slide. Why talking to patients about cancer screening is important? As you know, tests can help detect cancer early when treatment is more likely to be successful, and some can also detect precancerous conditions before they become cancer. And for this, we need the support from the MAs, because we sometimes have patients that, most of our patients, especially in the clinics that we are working on, forget, or they don't take questions to their provider, or they feel that they are going to do only what the provider tells them to do, or the test that the physician is going to order. And when we want to empower them so that they can request the test, the more we teach them, the more we empower the patients, the more they will ask questions and ask to be tested for different screenings. And the ones that can help us to do that are the MAs. And that's why we want to, like Judy was mentioning, all those strategies and all those questions the way you talk to the patients. And that's the most important thing that we need to remember. As you know today, routine screening in most of our community clinics are available for 3 type of cancers, which are the breast, cervical, and colon. And we invest a lot of time in increasing these rates, but this leaves the vast majority of cancers without available screening tests. But when cancers is detected early, 9 of every 10 cancers patients will live 5 years or longer. Next slide, please. We have found that after the pandemic, is not longer the most cited reason for screening delays. International gap is preventing people from receiving potential life-saving healthcare, with 30% of women 40 and older saying they don't know how often they should be screened for breast cancer, because in some grants or initiatives that we get, they follow some guidelines, and it gets confusing for patients, because that's why the clinics need to have the set of guidelines that they will follow, and to keep their patients informed and their staff informed. Early detection saves lives. Routine cancer screenings detect cancer early. Even if you have not signs of symptoms, and increase the likelihood your treatment will be successful. Next slide. Here I'm sharing some of the steps that we used in our charla. We have been working with Celebremos la Vida, a program from Prevent Cancer Foundation. This program has been with us for more than 25 years. And the focus is teaching patients about the different cancers and the importance of early detection. And I wanted to share this because it's something that you can use to share with your patients. Next slide. So this is a few pictures of the group classes that we do. We try to do 1 or 2 classes every month for all our patients that get screened for breast cancer, and also for colon cancer. In these groups, the charla is focused in the risk of cancer, teaching patients to eat healthy, how to add the physical activity to their daily life, and knowing their family history. This is with the purpose to increase early detection and also to prevent other chronic conditions and lower the risk of any cancer. Next slide. Involving MAs in grants, understanding the purpose of the grants and what the goals are to be accomplished. This is something that is a challenge for most of the clinics, because we have usually a team that is focused in running these grants. By sharing the information with the MAs, it's very important for them to understand the way the grant is going to work, and what needs is going to cover of the clinics for the patients that we are serving. So as you can see here is the grants we get are a contribution to the success. For the contribution of the success of the grant, we need the MAs, we need the front desk, we need the physicians. When we do it together, it becomes easier and we can accomplish more. So the most important part of the grant are the needs they will cover, the importance of creating new collaborations and partnerships for the success of the grant, and and to benefit the ones that we are serving. And the importance of knowing the changes and impact it will occur as a result of a grant in our daily tasks, especially for our MAs, that they already are doing a lot of, the day-to-day tasks that they need to do to support the physician they are helping. Next. And just your collaboration makes every project a successful. And I can tell you that I have experienced that with all the programs that I have been working in our clinic. We are able to do so much more when the MAs understand why are we working for new initiatives every year to increase the rates for screening, especially for breast, cervical, and colon. Thank you.
Thank you, Doris, for excellent presentation. I think what you shared definitely shows how important and valuable the MAs are to the process of keeping our patients healthy and encouraging screening. So really, thank you for sharing your perspective and strategies to engage MAs more in the process. And so at this time, we are going to welcome questions from the audience here, and just want to thank all of our presenters. And as you are thinking of your questions, please post them in the chat, or feel free to unmute yourself and ask your question, raise your hand. And before we get into the questions, I'm just going to launch 3 poll questions really quickly, because we would love your feedback on today's session. These sessions are designed by the task force to really meet the needs of those who are working in colorectal cancer screening and engagement. So the first question is going to have to do with the content of the webinar. So you can just go ahead and answer the poll, please. It's looking like we have 69% that have participated. A few more still thinking. %, so that's a pretty good response rate. I'll give it another few seconds and then I'll end this poll. Oh, one more, 83%. Last call if anybody would like to answer this question. So thank you. It looks like we were consistent with our messaging and the presentation. So thank you for responding to that poll. We'll just share the results and then we'll stop sharing. I'm going to launch the speakers. So this next question has to do with the speakers, and it states the speakers were knowledgeable about the content discussed. Yes, no, unsure. All right, and be thinking of your questions too as we have the poll going. We're at 75%. I think that's probably as good as we're going to get for this one. So in the poll, share the results here. Again, 100% agreed that the speakers were knowledgeable. And final question, and this is really an important one. It has to do with the time of the webinar, because we really work hard as a task force to ensure that we plan these during a time when MAs such as yourselves can attend. And if you prefer a different time, you can't do this through the poll, but please put it in the chat, a different time or day, or what might be better for you. Some of you said no, so we'd love to hear what maybe works well for you. Okay, so we have about 83% participated, which is consistent with our others. I'll just share. So the majority said this was a good time, but again, if you have another preferred time, please share that in the chat. There's at least 4 of you that would prefer another time. And so sharing those results, and then now I will stop sharing and welcome any questions. We have a few minutes left for questions. And we thank you all for your patience with some of our technical difficulties, and you missed out on hearing Mary speak, but you got the benefit of her knowledge and experience through the slides. And I'm sure we will encourage her and enlist her in a future webinar. She has a lot to share, so we always value her sharing her experiences. Don't see any questions. Oops, I don't know why that popped up. Okay.
Thanks for your help, Arnie, in getting through it. I'm going to sign off. I appreciate everybody and the good work that all you guys are doing. Thank you.
Thank you, Judy. All right, well, I think we have everybody's still contemplating, so we are at time. So I want to again thank our speakers and sharing the contact information here for our task force. Kathleen Connors-Duras and Mary Jane Joseph work hand in hand as co-chairs of our task force. And again, want to thank everyone for joining, and hats off to all of our MAs. You are truly wonderful individuals, and as Doris said, you're full of passion and compassion. So we thank you and celebrate yourselves today, and we look forward to seeing all of you on a future webinar. Take care.